All right, good morning, everybody. We are talking about ERISA, and actually, let me go back to my title slide again, just so everybody knows where we're talking about. We're talking about ERISA compliance again. This is second week. First week, if you missed it, don't feel bad. A lot of background information. You learned about Studebakers and stuff, and the shutdown of the Studebaker plant that kind of led to ERISA today and its inception. Going forward from there, we're going to get into a little bit meatier stuff. This week, we're going to start talking about what ERISA actually requires, how do you comply with ERISA, and all that sort of fun stuff. So the first part, I'm just going to start out with, a kind of a rhetorical question, and is why are so many employers out of compliance with ERISA? Well, there's a lot of reasons. As you can see in my slide, a lot of people either don't know that they're required to do anything or don't understand what they are required to do. A lot of people, and by people I mean companies, just think that the insurance certificate that they get from their medical carrier is gonna comply with the ERISA rules. And there's some I understand why people think that. I mean, when you do your retirement plan stuff, your TPA with your retirement plan takes care of all the ERISA compliance for you. They draft the plan document, they draft the SPD for you, they handle any SMMs, they handle all the ERISA compliance stuff that that happens on the retirement side. But for some reason, there's a giant disconnect on the health and health and welfare side. The health and welfare side, I've seen maybe one carrier provide a sample SPD that was largely disclaimed to say, hey, here's a sample SPD, run it through your attorney, though we don't stand behind this, and we can't promise that it's right for what you're looking to do. There's just a little expectation when you hire a company on the ERISA side of things that they're going to take care of it based upon people's experience with the retirement side of the world, and that's simply just not the case with health and welfare benefits. ERISA is tricky, it's complex. Some might even say boring. I wouldn't disagree with them. I usually like to make jokes about things just to lead up, break the ice a little bit. There are no jokes about ERISA, which is probably the joke. There's nothing funny about it, really. There's nothing funny you can make about it because it's a lot of, it's the quintessential red tape that you have to deal with in terms of governmental regulations. That's ERISA on the health and welfare side in a nutshell. Another reason is that in the past, the federal government hasn't gone over the top with enforcement actions. There's been just not a lot of a government action on it. However, since the ACA came into effect, the Affordable Care Act, there's been more enforcement. They've been stepped up enforcement. There's been more coordination between governmental agencies, between the IRS and the DOL and other, OSHA. All those governmental agencies are talking to each other now, and they're sharing information. They're like, hey, we did this workplace investigation, and it turned up that these people might not have distributed their summary plan description this year, and they, pass it over to their buddies at the other agency. And so there's a lot of that going on now, and it's not, I guess, in my opinion, really wise to test the federal government in terms of what they're going to do and what they are not going to do in terms of compliance. All right, I was going to tell Dan to switch it to the next slide, but I forgot that I'm in control. All right, so here's just some of the penalties that you can face if you are out of compliance. if the Department of Labor gets a sniff of a problem with your plan or with from one of your participants. So you can see here that these fines can get quite costly. You know, some of these fines are day by day. So the failure to provide a summary plan description to our participant increases each day you fail to do it. And you can see that they add up quickly. You know, $250,000 just because you failed to give someone, you know, in essence, 10 pieces of paper. That is a pretty big fine. And that's a real easy area to remedy in terms of compliance. We also are going to talk about Form 5500s. I think that's going to be next week for the cherry on top in terms of talking about ERISA compliance, but there's also fines and penalties for not filing those too, and those also rack up by the day. So you can see you can get a lot of fines here, and the discrepancy here, if you look at the second and third point down there, the $250,000 almost, and the $10,000, those are two different levels of fine that I think it's IRS or the DOL, actually, the DOL can levy. So you can get one file for not providing it and one file for not having it. They basically double up on each other, and it is not a fun place to be in. All right, so now that we talked about why companies aren't in compliance, and we talked about just briefly a little bit about what happens if you are not in compliance, what do we need to do to stay in compliance or to get in compliance? I mean, in theory, it's really simple. Number one, you have to have a plan document for each plan. So if you have a medical benefits plan, you have to have a plan document for that. If you have a dental plan, you have to have a plan document for that. Vision, you know, et cetera, on down the road. Cafeteria plans, et cetera. All those need to have a plan document. Those are essentially the rules of the road and the rules of the plan. And what happens is that if you have a plan, it has to abide by those written rules that you have. You have to follow them strictly. And there's fiduciary standards that apply. Now, for most fully insured plans, you know, that if you got Blue Cross Blue Shield or Medica or Aetna or whatever you have, where you submit claims to them and they just pay out of the insurance policy that you have, those fiduciary standards are basically lopped onto the insurance company. Where you have to get more concerned about your fiduciary rights and I guess responsibilities is when you are handling plan funds, such as if you have a self-funded plan or, you know, uninsured plan, sometimes they're called. When you have that pot of money there to pay out employee claims for whatever reason, then we got some more hoops to jump through in terms of being in compliance. If you do have that, you have to worry about fidelity bonds, which is different than fidelity insurance or officer and employee insurance for anyone that handles those funds. And you have to make sure that the accounting is up to snuff, and you have to have make sure that all your books are clean and all the money is tracked appropriately. After the plan document, we have a thing called the summary plan description, an SPD. An SPD is, I think we're going to talk about it in just a little bit, is just a summary, not surprisingly, of the plan document. You can figure that out by its name. You have to have a mechanism to furnish these to your participants, and we're going to talk more about that. This is a key failing in terms of what companies do or don't do. A lot of companies do not understand what is required in a summary plan description. They don't have one. They don't have a way of distributing them to their employees. And finally, on this slide, we're going to talk about just briefly SMMs. It's a summary of material modification. So if you have a plan and that plan, let's say you change carriers from Blue Cross Blue Shield to Aetna on your medical side, you're going to either have to have a brand new summary plan description that indicates that change in carrier, or you're going to have to issue a summary of material modification to the participants. I believe the deadline is 180 days after the plan year in which the change was made. And then you would have to hand out the SPD and the SMM to any new employees that start after that. Easier way, in my opinion, is just to update your SPD all the time, annually when you make those changes, if you make them, and shoot them out at that point. Again, this is just a little, we're going to skip over this slide just a little bit because I hammered most of it already, but this is more about what a plan document is, and what a plan document would look like and what's included. So in the interest of time, we're going to move on. And we're going to talk about a wrap document. So like I said earlier, many employees think that those insurance certificates handed out by the insurance company or insurance policy documents that go out to employees are going to do all they need to do to comply with ERISA. And with that, you're about halfway there. So with an SPD, you can either have a whole summary plan description where you write down everything that's required to be in an SPD and hand it out in one big document, or you can cheat, and I say cheat because it's so much easier and so much faster for compliance, and create what's called a wrap document. And the wrap document, you know, it's not something by LL Cool J or Run DMC. A wrap document is, if you want to think of it as a book cover, you know, those covers, book jackets that go around books. So think of the book as the insurance certificate that sent out by the insurance company. That insurance certificate does not have everything that is required to be in an SPD according to the DOL and the IRS. And so what the wrap document does as this book jacket, I might be dating myself because everyone's got Kindles now, but the book jacket includes the information that is not inside that insurance certificate that the government wants to see. And so some of the stuff that's missing, you'll see listed here. Who is the plan administrator? Generally going to be the plan sponsor, which is the employer. Who is the fiduciary if you have funds? What is the plan year? Is it January 1 through December 31st? Is it, you know, June 1 through May 31st? Is it something else? What is the name of your plan? You know, the Acme Company Health and Welfare Plan is probably what a pretty common name is. Designation of how many plans, plan sponsor stuff, it can all, it would all be wrapped up into that document. I'm going to skip that slide in the interest of time. We're going to talk again about you know, bundled plans. I call them I guess mega wrap plans. And so while you can have an SPD for each plan, like one for medical, one for dental, one for vision, and so on and so forth, you can also wrap them all into one giant mega wrap document. That is, you can bundle your medical, health, dental, and any other health and welfare benefits into one giant plan. And in that plan, you can only have to be required to issue one summary plan description. So if any of you have done an SPD wrap document with us in the past, this is what we do in the sake of convenience and ease of use for plan sponsors. It makes it real easy. You only have to worry about one summary plan description. You only have to worry about one document to distribute to participants or new participants, or one document to update. You don't have to worry about coordination between all these different documents because it's all in one shot. And the good news about this is going back to my analogy of the book jacket, you don't have to send out those insurance certificates that come with your plans. Those can be distributed separately by the insurance company, and the DOL has said that's completely cool. We'll accept delivery of a couple different documents at a couple different times and assume them all to be one document and to be one summary plan description. And so what we do is we wrap them all and we bundle them all into one, I call it a mega wrap document. Other people call it different things, but for our purposes, that's what we're going to go with. And what you can do is go that path. It makes compliance so much easier and so much simpler, and you don't have to worry about those $250,000 penalties potentially adding up for not distributing your summary plan description and your other documents. So just real briefly, I know we're running out of time a little bit. The question is, who must be provided an SPD? Basically, anyone who's a plan participant is going to have to get one way or another. There's no exception if you only have one participant in the plan. There's not a magical threshold. If you have a plan that's subject to ERISA, you have to issue an SPD, period. Be it a plain old SPD or an SPD wrap or a mega wrap. One exception is beneficiaries. So like my children would not have to get a copy of an SPD. If they give it to me, that is going to be considered to be sufficient. Tricky one that you guys might miss sometimes are COBRA beneficiaries. If you offer retirement benefits and if you have a QMASCO, which is a qualified medical child support order from child support cases, those are going to be also people that are going to be required to get a copy of the SPD. All right, so when and how? SPD's got to be furnished within 90 days of when the participant first becomes covered, within 120 days of when the plan comes into existence, if it's a new plan, and it has to be updated. Once again, I recommend updating it every time you make a change, but if for some reason you don't have any changes, it's good for 10 years. If you do make a change, you have to update it at least once every 5 years, or you have to, and you in the interim have to include the SPD with all those SMMs. A lot of jargon here, I know, but it's so much easier just to do a new SPD. And how do we distribute them? Well, the IRS gives us, or the DOL gives us the genius language in a way that, quote, reasonably calculated to ensure actual receipt of the material, using a method that, quote, is likely to result in full distribution. So there's a couple different ways to do that. Easiest, well, I don't know if easiest, but the clearest way is to hand everyone a stack of documents. That's the SPD. Option 2 would be to mail them a paper copy to their mailing address. Option 3 is to email it to them, and there's an exception for employees that work at computers, that need computers for their job and have access to them, where you can email them, or you can do electronic delivery through a benefits site, through your payroll provider or through your HCM or what have you, intranet, if you have that. And for those employees that don't qualify for the computer exception, they can opt in, and you can have them sign a form saying, I agree to electronic delivery of ERISA documents. From there, you're all good. But this is, again, where I see a lot of companies fail. Plan sponsors don't understand that the insurance company doesn't take care of this for them. And so they're just, I wouldn't say willfully ignorant, but just, accustomed to the retirement side, where the third-party administrator handles a lot of this for them and they don't have to think about it. With that, I think we're going to pause in our SPD journey until next week. Next week to Wednesday. Today's Wednesday. Sorry, I missed a day this week. Next week, Wednesday, same bat time, same bat channel. We're going to talk about 5500s, 5500 filings, and solutions that you have to keep this all under compliance. I don't see any questions on the side over here. Dan, if you see any, let me know. But I don't see any right now. So till next week, everybody. Thanks for coming.